Hey, this is Alissa. And before we start this episode, I want to take a few minutes to talk to you about the AMSN virtual convention experience because 2021 AMSN convention is going to be once again virtual. Last year, the virtual convention was hosted on a virtual platform, which made it really easy for us to join a session, see the comments, and interact with our presenters. We were also able to record a podcast live and have a live audience. It was so much fun. It was so easy to stay connected. And while we didn't have the same experience of in-person interaction, this was the next best thing. We had virtual networking, happy hours, and so much fun just being able to connect with other like-minded med-surg nurses. So make sure you take the time, go to amsn.org and register. I'll see you there.
This is Evie.
This is Alissa.
This is Chelsea.
And this is Caroline.
Welcome to med-surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses. Hi, guys. Thanks for joining us today on this episode of med-surg Moments. Unfortunately, Caroline and Chelsea cannot join us today, but I'm here with Evie. Let's check in and see what's new with you.
Thanks, Alissa. So I've been so busy. I just came back from a conference and it was in Ocean City. I do have to say that. But my family and I were there. The conference was basically focused on some community initiatives. So nothing to do with nursing per se.
Well, tell us more about your community involvement, Evie.
I work with, facilitate, if you will, participate in community events and community meetings that really stem from some of the political things that are taking place at our local city hall. So we meet and we discuss things, we debate, we go back and forth sometime with our politicians, but it keeps us actively engaged in the matters that are making a huge impact, whether negatively or positively in our community.
That's awesome. What a great job, like being involved in your community. A lot of people have a lot of opinions, have a lot of feelings and thoughts about what's going on, but just stop short of that community involvement.
Mm-hmm.
So commend you for getting involved. That's awesome.
Wow, thank you. What's new with you? I know you're always having something exciting going on, whether you're traveling. What's been going on with you?
I wish I was traveling, man. I am so gun shy on travel plans right now. Big project for this weekend is going to be working in the yard. We're going to be putting in like an RV gravel something or other for parking RVs. So that's the big plan.
So do you have an RV, Alissa?
We have a travel trailer. So Right now it's parked halfway on our grass in our side yard and like halfway on some wood chips.
Okay.
Yeah. So it's time to take the grass out and actually put an official space. So it doesn't look like I just put our travel trailer in the side yard.
So I'm a city girl. So anything, I guess, larger than a SUV maybe is an RV to me.
Gotcha. Okay.
I don't know the difference between a travel trailer and an RV.
Well, so I got the answer for that one. I'm not very good at this either, but the difference is the RV has like the truck and motor.
Okay.
It's all built into one. And the travel trailer is the one that you like hook onto your truck and tow it. Yeah.
Okay, got it.
There. Now you're well versed. Now you know.
Thank you.
All right. So on that note, Evie, let's switch gears and talk about achieving patient-centered care. Because are we going to put them in the RV or are we going to put them in the travel trailer? Just kidding. All right. First of all, we should probably define what does patient-centered care even really mean?
It's putting patients and their families at the heart of the care that we provide, including the patient from the time that the patient is admitted until discharge, including the patient in every decision that needs to be made, educating the patient, I should say, about what is going on with their care, where we are, what needs to be done, what has not been done, explaining results to the patients, and answering that major question, why, when patients ask, well, why do I have to have this again? Or I've done this. So being able to explain and answer that why question to our patients, letting the patient know that you have the power, you are in control, but this is what we're doing and this is why we're doing it.
I love that. I would also add to that, being respectful of the patient's preferences, their values, and using those as a guide for your clinical decision making. So a partnership, right, between the healthcare team and the patient as you're making your plan of care and guiding those clinical decisions. It's really informed care on the side of the patient, that partnership of this is the situation that you're in, and these are all of the options, and allowing the patient's preferences and values to guide the decision making so that we're not pushing our medical agenda per se, if you know what I mean.
Yeah, I think that's important to remember, particularly you mentioned the values. And sometimes as nurses, the patient's values, first of all, we may not even know what they are. So it's a good idea, again, in achieving patient-centered care to find out what those values are to our patients. What's important to the patient right now, today, or if you're going to be admitted for a number of days, what's important between now and the time you leave our care? So asking those questions, building that rapport with our patients, finding out what's important to the patient. That is also equally important that the nurse knows that, because the nurse is going to be the primary, I would say, director of the care that's provided to the patient, or at least to that patient. That nurse is going to be the primary contact through which his or her care is delivered. So it's important because the nurse will be an advocate for that patient to the doctors and for the patient. So communication is key, knowing what the values are and being able to communicate that up and down the line to the patient, from the physicians all the way in between, and any other clinical staff that need to contact with that patient.
It's interesting when you were starting to talk about patient advocacy. I remember so many situations where I would go in and talk with my patient, talking throughout the shift. I always worked nights. So talking to them about what's important to them. The doctor's going to come in at 5 or 6 a.m. What kinds of things do you want to make sure we address with them? But by the time the doctor came in, either the patient had forgotten or the patient essentially got railroaded by the doctor, because the doctor came in with their own agenda of the things that they needed to discuss with the patient. And so it was really important to be present to advocate for what the patient wanted to address. Remember, you wanted to talk about this. Remember, you wanted to talk about that, and really help the patient still make their voice heard. And I would absolutely classify that as patient-centered care. We're making sure that the patient's needs are being met, their voice is being heard, especially during an interdisciplinary round.
And what you mentioned, Alissa, I think is an important key, because I think every nurse has probably experienced this with their patients. When the physicians come around and they're rounding, sometimes they go into the rooms and the nurses don't even know that they're there. And the physicians may give the patient information that the nurse has not been privy to at that time. And so you walk into the room and the patient is telling you, doctor said this, and the nurse, you're standing there looking like you have two heads. Oh, well, I didn't know that, but let me follow up with that and I'll get back to you. But even in that moment, you can convey to the patient that his or her values and interests are still being cared for. I say, give me a moment, let me follow up with doctor and I will get back with you. I promise you. And you follow through with that. But again, that's still letting that patient know that you may have heard something, or you may have been given some information, but it's not lost. It doesn't just end with you. As your nurse, I'm going to follow up with that to make sure that we still are all in alignment with what the goals are.
Exactly. Yeah. And unfortunately, that does happen because you've got one medical team for one patient. I don't know how your unit works, but we usually had many different services on our floor with many different patients. You can't be in all the rooms. You've got 5 patients. You're one person. Hard to make it into all of that rounding. That happened a lot. Like, I'd go into a trauma room and find out that the patient's C-collar had been removed. And it's, are you being non-compliant, or did your C-spine just get cleared? So a lot of those panicked moments. And so, yeah, very important to make sure that we're closing that communication loop and showing our patient that we are going to follow through on their care and make sure that we close that loop. And a part of that patient-centered care, right? It's not just the patient that's at the center of it. It's their family. It's the caregivers. It's the entire interdisciplinary team needs to work as a team, seeing the patient's goals and desires being everybody's goal, right? Everybody should have the same goal of, if this patient wants to go on a DNR, DNI, or go into hospice care, or whatever decisions the patient is making, everyone needs to look at it as, okay, this is our goal for care. This is our goal for treatment. And sometimes that can be challenging. Sometimes the patients want things, they want to go in a direction that the treatment team may not agree with because they feel like there's more that can be done or there's life-saving measures that can happen. And so sometimes we have to manage our own emotions and our feelings about what the patient wants versus what we would want for the patient, if that makes sense.
Mm-hmm. I'm going to piggyback on that, Alissa, because I actually want to say, as far as including the family in the decision care and the setting for the patient care, I think we failed, particularly over the last year and a half, with providing the family input and the family as a resource for our patients during the pandemic. And I'm not saying that to just point out the bad, if you will, or to point out negative, but I think as a profession, we need to find some better ways and come up with some reasonable solutions that we can include the family in the care of our patients, even during a pandemic. It was very difficult for me as a nurse to know that even while patients were suffering and some even dying, that they could not have their family with them because of a pandemic. So I'm still struggling with that as a nurse. That has been one of the single most upsetting aspects of this pandemic for me as a nurse, and having patients who were not able to have their family there, even in their last moments.
You know, Evie, I think you really bring up a bigger issue altogether about how have we possibly been achieving patient-centered care during a pandemic when we're not able to keep families at the bedside to be an additional advocate, minimizing caregivers at the bedside. So minimizing that contact to truly know what the advocacy needs to be. And we're fighting a new infection where we don't know with 100% certainty of the best treatment options, right? Everything's still in early research development stages of what the best course of action or treatment plan should be. And so this pandemic presents a completely different situation in terms of patient-centered care because we don't actually have all the answers. We don't have the best answers. We're in the making it up as we go along stage, like trying to figure this out as we go. And one thing that we know for sure is that patients who have access to their family and their support system and all of that do better. And we also, on the other hand, know that if they're in the room, they're going to get sick. When you say that it was a failure, I have to agree. How do we overcome this, especially when we have all of these potential for more variants and an extension of the pandemic? Because this patient-centered care, you're right, it's going by the wayside because of the pandemic. So how do we overcome that, or how do we circle back to achieving patient-centered care despite the pandemic?
And again, I don't have all the answers, but I do know that
Me either.
I do know that if we're going to maintain or even improve our patient-centered care model, we will have to spend some time reevaluating the mission and the goals and the values that are aligned with delivering that care, particularly because of, if you will, or in spite of a pandemic and more variants and maybe future infection controls or measures that may come into play. So we will have to spend some time as a profession reevaluating those missions and those goals wherever the course takes us. But again, at the heart of patient-centered care, we definitely have to spend the time finding out what's important to our patients. And the key word, I think, in that is time. Time is such a commodity in and of itself. And as you mentioned, sometimes we have 5 patients, maybe 6, and depending on the size of the unit and the staffing. But we need to find better ways to carve out that time to talk with our patients, to ask them what is important to you. Again, for this visit, this moment, by the time you're discharged. I think that's the heart of patient-centered care.
You know what, Evie, I would agree with you. And I would even go so far as to say we may not have the answers of how to make it better right now during this pandemic and the restrictions that we have, but it only makes it that much more important that while the patient doesn't have other advocates, the nurse is that much more important playing the patient advocate. So they need to invest that time and they need to find out what is important to the patient so that they can be the advocate, because there aren't any other advocates for the patient.
We still have a lot of work to do, Even in patient-centered care, just any other, let's say a medication, you can give too much of a medication, you may not give enough. So that pendulum can swing one way or the other. Finding the right dose at the right time for the right reason is key. But let me ask you this. What about patient-centered care? Can it go too far? Can we focus on only the patient's needs and wants to the exclusion of other components that we need to deliver our care? What do you think about that, Alissa?
I think there's definitely a point when patient-centered care can go to the extreme. I think a pain medication is a good example of that. Patients will often want more pain medication than what is safe for them. So I think that's a good example. Honestly, the unit that I worked on, we would get patients where we felt like we were expected to behave more like hospitality workers at a hotel rather than healthcare professionals. And it's when you start feeling like that, the relationship with your patient is more like that rather than a team advocating for health. When you start feeling like room service and the concierge, like that's when it feels like patient-centered care is going too far, because we really are here to monitor your health and wellness and make safe decisions for you as we're helping with your care. When it starts feeling less than that, it feels almost like disrespectful when we start feeling like all we're doing is delivering you a sandwich, and it's become demeaning and degrading on all your refusals of the medical care, but now all you want is a sandwich. You know what I mean? It just,
I absolutely know what you mean.
I'm sure you've been there. All you do is deliver sandwiches or something. It just, suddenly you're like, wow, I went to school for a really long time and all I do is dispense narcotics and sandwiches. When your relationship with the patient starts feeling like that feels less rewarding, and it feels more like you're being taken advantage of or manipulated in some way. Those are the situations when it feels like it can go too far, when the H on the building is hotel instead of hospital.
Yes. And I have said that. I know many of my colleagues have said and felt the same thing.
Yes.
And so, yes, it can go too far. When it does happen, I think we as nurses, I think we have let it build too far. We've let it go too far, not necessarily with a particular patient, but just the whole dynamic in that feeling, even getting to that particular feeling. But I think that's a good time to step back, maybe go talk to your manager, talk to some of the powers that be, if you will, when you have those forums. For a lot of hospitals have nursing forums where they have the open, I don't know what you call them, open door forums, things like that. That's a good time for nurses to collectively express what they are feeling and convey those thoughts and feelings to the managers, supervisors, and whomever. Again, we need to have, you said it earlier, balance is key here, and even balance with our patient-centered care. We are professionals. We do have the education and experience to deliver that best care to our patients, but at the same time, we want to be, I guess, respected as a professional.
Absolutely. And I think that respect goes both ways. In the definition of patient-centered care, it talks about the patient's needs and values being respected. And I think that respect needs to go the other way too. Our education and experience and time should be respected as we are giving a part of ourselves to every patient. Every day that we're at work and we're taking that patient assignment, we give a part of ourselves to that patient. So we would definitely want that respect coming back to us as we are giving that respect to our patient. And it's something that we automatically give, and it's not lost until a patient does something to lose that respect from us. That's something that we just automatically give. So it really isn't until the patient starts treating us very disrespectfully that we lose that respect for them in return. If we could get all patients to recognize that their number one teammate is their nurse, maybe we could help with some of the behavioral issues that happen.
Yeah.
I'm going to solve all the world's problems right now.
Exactly. That's why, again, this is why nursing as a profession, med-surg nursing, even more so, I think we have things that we still need to work on. We have the professional aspects, the clinical aspects that are still not just being researched, but we're still implementing, we're still learning how these avenues play out amongst each other to deliver that best quality patient-centered care to our patients. We still have a ways to go, Alissa.
Oh, absolutely. There's always room for improvement. That, I guess, if we had all the answers today, what would we do tomorrow? So there's always room to grow, always something to work on. All right, Evie, this has been a great conversation about patient-centered care, and I really appreciate all of your insights. It's been a really good one. We are running out of time, so I just want to remind everybody to join us for our 30th AMSN annual virtual convention. It's being held September 30th through October 3rd. We are celebrating 30 years dedicated to med-surg nurses, so join the global celebration at the virtual convention this year. You can register at amsn.org. We look forward to connecting with you on our next episode of med-surg Moments, the AMSN podcast. We'd also like to remind you to become a member of AMSN or renew your membership at www.amsn.org. You will receive lots of cool benefits and perks, such as discounted pricing on the annual convention and continuing education. We look forward to connecting with you on the next episode of med-surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback to amsnpod@amsn.org. That's amsnpod@amsn.org. We encourage you to help us spread the word and subscribe to med-surg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave a review and recommend med-surg Moments wherever you get your podcast to help us reach even more listeners. Until next time, I'm Alissa. And always remember, med-surg Moments is a moment in our lives, a moment in our med-surg careers that makes a huge difference.